Growing your calves can be surprisingly difficult, which can lead a lot of lifters to believe that they're just cursed with crappy calf genetics. But while that definitely can play a part, there's usually a bigger issue with the way the calves are being trained that's preventing them from growing the way you want them to. So let's take a look at the anatomy of the calves so that we understand the best way to train them to get results. Well, the two calf muscles that we're going to be looking to grow are the soleus and the gastrocnemius. The gastrocnemius is the large, two-headed muscle that most people see when thinking of the calves, but the soleus is just as important, lying under the gastrocnemius, which can push that gastroc out as the soleus grows, making the calves look bigger. Both of these muscles function to plantar flex the ankle and are used in day-to-day activities like walking, running, or jumping, making them active all throughout the day for most people. And the gastroc, unlike the soleus, is biarticular, meaning it doesn't only plantar flex the ankle, but also has slight control over flexion of the knee, specifically in the first 15 to 20 degrees of knee flexion from full extension, which means that creating a bent knee position will work the soleus more, since the gastroc will be shortened, removing tension from the muscle and making it less capable of producing force. So how do we incorporate this into our training? Well, let's first take a look at the two primary exercises used to train the calves, which are the standing calf raise and the seated calf raise. Since the standing variation has the knee in an extended position, it does a good job of working the gastrocnemius, whereas the seated variation takes tension off of the gastroc, leading to a much larger load being placed on the soleus. When doing calf raises, it's important to build tension on the muscle through slow and controlled movements that work through a full range of motion. There are two common mistakes that I see people make when doing calf raises that are killing their progress, and sometimes just making a few small changes are all that's needed to drive your calf progress forward. So the first mistake is loading up a ton of weight and bouncing through the movement, which removes the constant tension on the muscle and makes it much less effective for growth. You may still feel tension when bouncing the weight, but what's actually happening is elastic energy is building up in that Achilles tendon and then recoiling to lift that weight. The second mistake is working in a partial range of motion, typically going from full plantar flexion to a neutral ankle position without allowing that foot to get into full dorsiflexion at the bottom, removing one of the hardest parts of the lift and severely reducing the amount of mechanical work that the muscle is doing. By controlling the weight all the way up and all the way down, even adding a brief pause at the top and bottom to remove the use of momentum, you'll create a much more effective stimulus for growth, even if you're using less total weight, provided you're still getting close to failure. So when having trouble growing your calves, the first thing to ask yourself is, am I doing exercises that work both muscles? And if so, am I doing the exercises correctly? If you hit legs twice a week, you can make sure to train both muscles by incorporating standing calf raises on day 1 and seated calf raises on day 2, or vice versa. That way, you guarantee that you're getting in work for both muscles each week. And to take it a step further, since the gastrocnemius is both a biarticular and two-headed muscle, you can utilize different foot positions in different lifts in order to better target the specific parts of that gastroc. During a leg curl, for example, which is meant to target the hamstrings as the primary mover, a dorsiflexed ankle position puts a large amount of tension on the gastrocnemius at the bottom, allowing the gastroc to control that first 15 degrees of movement from full extension. Now, you do want to keep the ankle in a dorsiflexed position to keep that gastrocnemius active during this lift, but incorporating some form of dorsiflexed leg curl movement in your routine can add volume on the gastrocnemius, which may be necessary if you don't want to just do a ton of sets of calf raises. And lastly, one of my personal favorite ways to train my calves is to incorporate leg press calf raises supersetted in with my actual leg press. Not only does this exercise do a great job of overloading the calves, with typically much larger loads than a normal extended knee calf raise would use, but it also allows you to comfortably target either the medial or lateral head of the gastroc by altering which way you point your toes. Because this study from the Journal of Strength and Conditioning Research found that different foot positioning during calf training can induce portion-specific gastrocnemius muscle hypertrophy, meaning that the direction that you're pointing your feet when doing the calf raise exercise can bias either the lateral or medial head of the gastrocnemius to specifically focus on growth of that head of the muscle. And it found this by examining changes in muscle thickness of the medial and lateral heads of the gastrocnemius after calf raises were performed with either a neutral foot position, an inward pointed foot position, or an outward pointed foot position. And what they found was that outward pointed foot positions better target the medial head of the gastroc, inward pointed feet will better target the lateral head, and a neutral foot position will effectively target both. Now, this probably isn't a necessary strategy for most people, and I think that beginners especially can get away with just using a neutral foot position to hit both heads of the gastrocnemius evenly instead of trying to specifically target one head or the other. But if you are more advanced and want to split your sets into both outward and inward foot rotations, it may be a good way to fatigue both heads of that gastroc just a bit more. But in the end, we need to remember that the gastrocnemius and soleus are just like any other muscles and will grow just like any other muscle. And by utilizing proper technique, training both muscles consistently, and using a volume somewhere around at least 10 hard sets of calf training per week, you should be able to grow the calves and break through any plateau that you may be stuck in. So thanks for watching. Hit that subscribe button for me. Give the video a thumbs up if you liked it. Comment down below if you learned anything that you're planning on incorporating into your calf training, and I will see you for the next one.